Oh, I'm sorry, one more thing. I will be watching for the break at 2:15, and I will be looking at the chat box and alert Dr. Phillips. Somebody needed to put it on the chat box, but I know you'd like to have interactive. So
Yeah.
thank you. Thank you.
Thanks. Hi, everyone. I'm going to stay quiet till I hear everyone. Hi, everyone.
Hello. Hello.
Hi.
Hello.
Hi.
Thank you.
Hello.
I love it. I love it. I love it. Thank you all so much for being here. As I stated, thank you, Bonnie. Thank you. I'm going to shorten my bio next time because I get tired every time I hear it. So thank you all so much for being here. Before I begin, God, we have 3 hours together, everyone. How are you all feeling about a 3-hour webinar?
Great.
Okay, what's the energy like in the room? How are you all doing?
I get to work outside.
Oh, who is that? I'm envious right now. All right, what I would like to do is kind of operate today as though we are together and in a classroom. This training, Vicarious Trauma, Help for the Helper, it is designed with you in mind. Gonna provide some overview of content about the work that we do, Help for the Helper. So I want to hear from you all. When you think of the title Vicarious Trauma, what's the first thing that comes to your mind? What do you think we're going to be covering or doing or talking about today?
Self-care.
Okay, someone said self-care, definitely. Anything else? That's Jacqueline, thank you. Any other thoughts? What's the need from
trauma? Secondhand trauma from
secondhand trauma, definitely. Any other thoughts?
The emotions that we hold and the space that we hold for our clients and how that may or may not come home with us.
Deep, yes, indeed. Again, before we jump right into a dialogue, can anybody in the helping profession in this room, can you all relate to what that term or what the ideas and the concepts around vicarious trauma means for the helping profession?
It's basically experiencing trauma through someone else's, like if someone tells you what they've experienced or you witness someone else's trauma, then you internalize it yourself. I think you begin to experience it.
Okay. Any other thoughts? You know, when we think about the work that we do, I guess the first question I want to ask before I even jump in my slide, who's in the room? What type of helpers do I have in the room? Are they counseling professionals, social workers, peer recovery? Who's in the room?
Social worker.
Okay.
Social worker.
Counselor.
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 Okay, I hear us. I hear us. So is it fair to say that we all, oh, I see a high school teacher. Whew, God bless you, Miss Hopkins. Thank you. Guys, this is my personality. I have a social worker therapist in the room. Okay, so it's fair to say then that we all in here, in this room and in this space together in some shape, form, or fashion, we are, there's a psychologist. Thank you, Miss Haley. We are the helping professionals on the front line doing the heavy lifting. Fair? Is that an acceptable job title for us?
Yes.
All right, I'm giving everybody a new PD today. We're doing the heavy lifting on the front. So that's what we're talking about today, and that's what we will spend a little time talking about. I've said over and over again, and I'll keep saying it, this is going to be very interactive. Once I start sharing the screen, I will not be able to see your faces, but I ask that you just unmute yourself and jump in, whether it be a question or a comment. Through my slides, I have an awful lot of reflective questions and opportunities for case scenario discussion, questions and answers, and then we'll provide a dialogue and feedback. In the beginning, I'm going to ask everyone to be sure to have a paper, pen. If you're good at math, you don't need it. But if you're like me and you're not good at math, grab a calculator, your fingers and your toes if need be. Because after break, we will be doing the quality of life scale where you'll be asked to rate your own and identify your own compassion satisfaction, compassion fatigue, and risk for vicarious trauma. So I'll tell you all early to ensure that you have everything you need. Any questions before I jump directly into the slides? Everybody feeling okay? All right. All right, so there's my title slide. What we're doing today, who I am, and how long this training goes. Bonnie talked about our ability to end at 4 o'clock if we make it through all the content, which I see no reason why we should not. As I stated, and I keep stating, veteran group, what kind of webinar is this, veteran group?
Interactive.
A live interactive webinar, and this again is sponsored by Baltimore Health Systems, Baltimore. So let me move through my slides. All right, my disclaimer, as you all heard, I do work for the federal government and in several other entities. My disclaimer is that this webinar is a direct collaboration between myself and Behavioral Health Systems of Baltimore, and my presence here is not representing or associated with any other outside entity outside of the purposes of this webinar today. So here's our agenda, and I'm going to do my best to follow it. My slides are in accordance with the agenda. We take a break at about 2:30 to 2:45. Bonnie, you were right. I'm sorry. So I'll lecture for an hour, and then we'll have a break, and then we'll come back and conclude. So in the very early part of this, we'll talk about what vicarious trauma is, taking a peek at some of the symptoms and some of the experiences associated, taking a look at the impact of the trauma to one's emotional and mental health readiness, as well as compassion fatigue and burnout. We can't talk about vicarious trauma without introducing those concepts that are so closely associated. Then break, and then after break, as I stated, we will visit Beth Stam's professional quality of life, compassion, satisfaction, and fatigue scale, with an opportunity for you all to actually do the survey and rate your own professional quality of life as it relates to the work that you do and the helping work that we all engage in on a day-to-day basis. And then conclude with an impact of trauma on professional practice and client outcomes. And then, of course, someone said it, yes, effective self-care strategies. And what that means for us as helping professionals. All right, so our first opportunity to the dialogue is about my word cloud. I want you all to take a peek at it and just looking at the words, is there anything in particular from the word cloud that leaps out at you in the work that you do every day, whether it be what I do or what I need? Anything in there jump out at you?
Vacation.
I knew it. I knew somebody was going to see that little sneaky word in there.
Where is that at?
Who said vacation and why?
My name is Tiffany and I said vacation.
Oh,
I've made several switches between agencies since the start of the year, so I haven't had the actual opportunity to take a vacation since last September, so I'm overdue.
Okay, I like it. I like that you recognize that. Anyone else?
Self-care
What about it?
is very important for the helper to maintain self-care in order to help others.
Okay. As a collective, do we find it hard to engage in self-care? Do you find that difficult, or is that a part of your day-to-day as easy as breathing?
No, it's very difficult.
It's very difficult to find time to engage in self-care.
Okay. All right. So if we talked about today beginning to reflect and internalize, internally examine ourselves and the work that we do and what we would give our client, I'm hoping that we can walk away from this training today with some greater concepts of what I can do for me, from as minute as taking a walk to as extreme as going on a 20-day vacation. We want to begin to look at how to take care of ourselves as a helper. Any other thoughts about the word cloud?
Dr. Phillips, this is Bonnie. There's a couple, there's two comments in the chat section.
Okay.
One person said burnout, and the other person said compassion and fatigue, or compassion fatigue.
Okay. Thoughts on that? Whoever that is, type in, and please forgive me, I can't see it, so I'm not able to call your name out directly. Thoughts on the compassion fatigue? Why were those your chosen words?
And
Go ahead.
no, I'm sorry. I wanted to say you need to unmute yourself if you want to talk. Thank you.
Oh, that's okay. So compassion, compassion fatigue in general, because it's just a lot of energy trying to remain compassionate all the time throughout your day.
Okay. Other thoughts?
I would say for me, I understand compassion fatigue because it seems like there's so much other things going on in the world right now. It's hard to find the compassion with a caseload of other people when things seem so minute in the grand scheme of things.
Absolutely. That is the dialogue that I was looking for, right? Because when we are the helpers, and not only the assumption, the ethical responsibility lies with us to take care of everybody and to kind of consume the energy of what's happening, not only with the person that's in front of us, but with environmental circumstances and our own individual or collective experiences in the world. So that's kind of where we're going today with this content. If you all are indeed helping professionals, I understand that you know what vicarious trauma is, what burnout is, what compassion fatigue is. So much of the information today will kind of be forceful reminders of the work we do. But what I want you all to definitely walk away with is some some examples of what I can do to take care of myself. So here are our objectives for today. We're going to definitely define what vicarious trauma is and its relation to our work, describe the process of trauma and the impact on us as helping professionals. Definitely bullet 3 is immensely important. I want to capture some of your experiences with what's going on in our world today, in particular COVID-19. When I developed this content, the only thing that seemed like was going on was COVID-19. But since that time, we've had an eruption of social injustices. And I want to be able to provide a space today if that is included in your compassion fatigue. As well as understand the different dimensions of vicarious trauma, burnout, and compassion fatigue. Often those terms are all used interchangeably. However, they have very different meanings. And then identify healthy adaptive coping skills for being able to balance our work life and personal life. And then examine the emotional impact for failing to act when we know. And what I mean by that is when we recognize that we're tired, or we're recognizing that we're burnt out, or that we're losing our compassion satisfaction, what is our obligation, not only to our clients, but to ourselves, to take care of ourselves? So here we are with a dialogue. Surprise, I like talking, guys, and I like hearing from you. When you think about trauma, I just want to have a discussion before we get all into legal definitions and formal technical words. I want to know what comes to your mind when you hear the word trauma, or you think of a traumatic event. What's the thoughts that come with that?
Pain.
Pain? Anything else? pain, we're talking trauma or traumatic event. Other
I
than,
would say
go ahead.
anything that kind of had a negative impact in someone's life that they kind of held on to for an extended period of time.
Okay, so inability to forget the experience
Yes.
over a period of time. I like it. I like it. Anything else? Hearing the word trauma.
I think because I'm reading The Body Keeps the Score right now, I'm thinking of the body and just how trauma shows up in the body.
Who is
Can I hear
that?
that?
Yes.
I'm also thinking about ACE scores and like the book called The Deepest Well, and just how like even years after after trauma occurs, how we hold things in our body.
Okay, so you're talking now physical dimensions, right? I've had a traumatic experience or a trauma lived experience, and as a result now my body is now having some physical manifestations of what I've experienced. All right, I like it. Anybody think about fear? Can we think about fear being associated with a traumatic event?
Definitely.
Okay. Mr. Dimitri, right? Talk to me, because I know that you're I only have one male in the room. Talk to me about thoughts with fear and trauma.
Just the traumatic social events that have been going on. You living in fear. You living stressed out, not knowing what's gonna happen next. So
that kind of takes me into the second question on this slide, where it's asking you what types of populations or presenting trauma encounters primarily come to your mind when you think about trauma. We talk about people holding on to things and not being able to forget them, people being afraid, people now having somatic or physical conditions related to that traumatic experience. Or I'm gonna add a spin to it. Me, the helping provider, what type of people am I thinking about that I'm going to see that potentially could be experiencing trauma? What are your thoughts?
Domestic abuse patients as well as sexual trauma.
Domestic and sexual. So then we're talking about physical violence, sexual assaults, and sexual trauma. Definitely. Anything else? I think I heard somebody say something earlier about ACEs. Did somebody talk about adverse childhood experiences and their impact on traumatic outcomes?
Yeah, I mentioned ACEs, just like working with students and just like trying to speak about ACEs and how just being aware of them and things that we can do. Yeah, things that we can do.
So and this is what we're talking. We're having a trauma discussion before we move into what, vicarious trauma. But being able to identify what happens with trauma, I think it better prepares us to know how to not only take care of the people that may be sitting in front of us, but ourselves as well. Do you all believe that people who work or live closely with someone that has experienced trauma are impacted? And if so, how?
I feel like you can, like, because they feel like they have to take the protector role to make sure the trauma doesn't happen again, or working through them and their trauma that they've already been through.
Okay, so kind of the responsible person now.
Yes.
Anyone else? Any other thoughts? How are other people that's close to someone with trauma impacted?
I think sometimes we
think
try to be the fixer, so that we can kind of fix the trauma and it doesn't happen again. So I think we take, like she said, that protector role, but also kind of fix things.
Okay.
I'd also add as far as children who are directly impacted. So I think of elementary school kids that I've worked with, and maybe the mother has experienced a history of trauma, maybe through abuse or neglect when she was being raised, and so she wasn't able to maybe emotionally or physically be there for her child, and like the direct negative impact that had on the child's mood and behavior.
Okay, so we're speaking about, and everybody is actually, the biopsychosocial impact of traumatic experience, not only to the person that is dealing with the trauma, but someone close. And that moves us into what we're talking about today as helping professionals vicariously witnessing or experiencing someone else's trauma. Last question, and then we're moving into our discussion of our slides. Do you all believe that trauma affects everyone in the same fashion?
No.
Why?
Everyone processes things differently and everyone's response is different. So I don't think that it affects everyone the same way.
Okay, so trauma, definitely true. We have tons of literature that talks about the various aspects of vulnerabilities for traumatic stress reaction after a trauma experience. So that is indeed the truth. But looking at vicarious trauma and the helping profession, when we think about us as professionals, the threshold of what may affect one provider versus another provider vary in large dynamics. So it's really important when we're thinking about the work that we do in trauma realms, that one, we know how to take care of ourselves, and two, we know when we are indeed impacted or affected by what we're hearing or experiencing.
Dr. Phillips, this is Bonnie. Can I stop you 1 second?
Please.
The book that you held up, someone wanted to know the title and author, and I can type it in the chat. Can you repeat that for us?
Yes, it is The Body Keeps the Score. Brain, mind, and body, in the healing of trauma. And it's by Bessel van der Kolk. I hope I'm in the screen where it's seen.
How do you spell Coke?
K-O-L-K.
Okay, thank you. And also one other person said, when you were talking about does everybody experience trauma the same? Someone said absolutely not. And another person said everyone experiences can be different. Thank you.
Thank you. Thank you all for the live interaction of this webinar. It excites me. I'm a classroom teacher, so behind the web is a whole new experience for me. So here are the formal definitions of what we're talking about, and you all outlined it really well. I just wanted to be able to give you some literature and some research to support what we're talking about.
What are y'all doing?
Okay, SAMHSA, according to SAMHSA, trauma is a response to an event, a series of events, or a set of circumstances experienced. Can somebody mute? I hear some babies in trouble, I think. Trauma, according to SAMHSA, trauma is a response or a series of events or a set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening with lasting adverse effects of the individual's functioning and mental, physical, social, emotional, and spiritual well-being. So a very large definition, all-encompassing of an individual's entirety. So when we're thinking about trauma, physical realm, social, emotional, and spiritual well-being, and that's SAMHSA's definition. And I thought that was the most conclusive to cover everything that you all actually just said about trauma. With vicarious trauma, it's opposite. It is the emotional residue of exposure that helping professionals have from working with people as they are hearing their trauma stories. So I didn't need to necessarily witness it, be there firsthand, but it's a secondary encounter where I'm witnessing and feeling and experiencing your pain, your fear, and your terror associated with the trauma. And then McCann and Perlman in 1990 coined vicarious trauma to describe disruptions in the cognitive schemas. So there's a negative transformation about the work that we do as a result of an empathetic engagement with trauma survivors, helping professionals become vulnerable over time as they continue to deal with the traumatic narratives and experiences of those that they treat. Any questions on the definitions at all? All right, so I'm just going to move. Here is a full slide of trauma symptoms, as vicarious trauma symptoms as they appear. Now, keep in mind, with vicarious trauma, we're talking about that person that did not witness, but actually is doing the work with an individual with trauma narratives. So for the vicarious trauma individual, also secondary trauma is a coined term that is used interchangeably to mean the same thing. The signs and symptoms for vicarious trauma, it talks about arousal, avoidance, thinking about work when you're not at work, kind of finding it difficult to cut the switch off, thinking about that high-risk patient when you should be at home somewhere in life balance, but finding it immensely difficult to cut off the brain thinking about things that are happening with that client or with work. Losing sleep, solely due to the trauma narratives that are constantly ruminating through your mind, worried about if you are doing enough, right? When we start seeing changes in beliefs about effectiveness in my role as a helper, pretty indicative of potentially a vicarious traumatic reaction. Loss of interest in activities, kind of life just looks like work, and then home, and then back to work. I don't really do much of anything else. Although I'm doing this, I still feel pretty hopeless about my work, with not really a good positive outlook on whether I'm doing good with the work that I'm doing. Elevated irritability and anger, and this irritability can be discovered across all domains, but with a particular focus about colleagues and work and how I'm doing in my work setting. Being hypercritical of work and clients, again, concentration and sleep deficits off, and negative ideas about your role and duty. If you pay attention closely, what do these vicarious trauma symptoms mimic? What do they look like? If we had to think about some diagnostic criterion, what do we see?
We see anxiety. We see a little bit of depression. Could be signs and symptoms of anger problems.
They mimic trauma, right? They mimic the symptoms associated with a post-traumatic stress reaction, minus the criterion A of seeing the trauma, but you're actually experiencing it secondary. So indeed, a vicarious traumatic experience or symptoms that are so intense and so critical and with long-term and longevity, it can indeed escalate to deeper mental health deficit and decline. So here we are, just from what we know about the definition of trauma, what types of traumatic experiences increases risk of trauma. I kind of threw together a knowledge of, who did I lose? Did I lose my screen? I'm sorry, guys. All right, I threw together an application knowledge where I want us to just, before we even read the application question about knowledge application, I want to assess this picture. What do you see from this little cartoon? What are your thoughts? Just from the cartoon.
This is Bonnie. I probably shouldn't be commenting, but I can't help myself. Maybe the trauma is sometimes very evident to an external person, but the person themselves who's experiencing an axe in their head doesn't realize what's going on.
Okay. Any other thoughts? Thanks, Bonnie. You should be participating. You're not just a timekeeper, you're engaging as well. Thank you. Any other thoughts? Cartoon.
The doctor looks pretty calm and the patient not so much.
The doctor looks completely unbothered. Now, how can I be of assistance? So some numbing there. So what I want us to do in the knowledge application, I kind of got a little scenario that I want to have a discussion around. Justin has been working as a frontline mental health worker for a community-based clinic for 15 years. He manages a caseload with individuals presenting with cumulative stressors, many of which are trauma survivors. You notice that Justin is irritable, withdrawn, losing confidence in his effectiveness with his patients, and appears sleepy and tired most of the time. Justin really cares about his patients. However, as of late, he has difficulty recognizing his purpose and his reason for work. What are the signs here that you see that potentially something could be wrong? What signs do you see here? What are the areas of concern?
Maybe a lack of compassion.
Okay.
Irritable, withdrawn, lacking confidence, sleepy, and tired.
So all of, I'm sorry. I lost somebody. Did somebody have something and it's fading out? So the stress, the irritability, not feeling connected with his patients, he cares, but lately he's recognizing that he doesn't feel that he has purpose for work. What are the long-term emotional health, what are the long-term implications for Justin if nothing is done?
He can develop physical problems, medical problems from him not dealing with his mental or psychological issues that he's experiencing.
Okay, so progressing to medical out of the, we see here where he's withdrawn. His attitude about his work is no longer as upper. You know, we're talking 15 years of direct face-to-face practice with individuals that are trauma survivors. What potential impact or dangers exist for patient care, if any?
He could miss important things. He could not be kind of doing all tests he should. So he could be missing a lot of important things if he's kind of burned out and not into his work.
His
Now,
clients could feel like he doesn't care and that he's not actually supportive, and that would impact the relationship and the rapport.
so relationship, potential danger outcomes, anything else?
Misdiagnosing or providing ineffective treatment interventions.
All right. So because he's experiencing these things, we're looking at a potential risk to patient care with a decline in his ability. And I guess I'll go on and stretch and ask the question, can lacking confidence change competency levels?
I think so, because sometimes when you lack confidence, you sometimes you might not make the correct or make the correct treatment intervention for that individual, because you're not sure if that is what you need to be following or if that is what you need to be doing for that client.
Absolutely. Now keep in mind with vicarious trauma, the symptoms manifest physically, but the initiation of it is a cognitive experience. All right. So when we're talking about, I don't believe I'm doing any good, I'm worried about how my outcome with my patients are, I'm irritable and I'm not connected and I'm kind of not sure if I want to even do this work anymore. These kind of ideas definitely have the propensity to change our effectiveness in client-patient relationships. So it's really important, good job with the knowledge application, but it's really important that we are constantly assessing ourselves and being honest and true with where we are on the compassion fatigue. I haven't got to compassion fatigue yet, but on the vicarious trauma scope of the work that we do. It is a very normal reaction to be a caretaker, frontline, first line individual working with people. It is very common to develop a level of connection with the care that we give our patients and losing ourselves in their trauma narratives. So who's at risk? Here's who's at risk. I asked when we first started who was in the room, and if you notice from the research, the top of the list were social workers and counselors. In addition, caregivers, that would be people that are taking care of people day in and day out, whether it's caregiving from a family member perspective or someone 24/7, responsible for the caretaking of another individual. Medical personnel, school teachers, I didn't put up here, but we have somebody in the room, so definitely frontline direct practitioners, police officers, crisis workers, and then of course the EMT firefighters. And the firefighters and police officers, more so frontline as well as vicarious, because they're working directly in the war zone where they're seeing these things. So the factors of vulnerability, remember the first question I asked, does everyone develop trauma and does everyone deal with trauma in the same way? Here's the literature that kind of supports the factors that increase vulnerability for vicarious trauma. That would be the workers with a personal history of trauma themselves, that not necessarily they only have trauma, but they have not thoroughly worked through their own traumatic events and their own trauma narratives. And their trauma emotions or experiences are stuffed. And perhaps when they meet someone else with a similar traumatic experience, it elevates the risk of their vulnerabilities for vicarious trauma. Someone said it earlier, definitely the literature reflects that mental health workers with higher rates of ACE scores themselves, adverse childhood experiences, are at greater risk for living and dealing with vicarious traumatic encounters, having very limited supports. And when we talk about supports for dealing with vicarious trauma, it's important to have balanced supports. That means supervision, someone at work that I can collaborate with on my cases, as well as a balance of supportive people outside of work. So if you're outside of work and you're talking as best as you can, still maintaining confidentiality. But if you're outside of work and you're talking about the things that you do at work with your support networks, probably not a good idea. It's important to have a support team that you can be a different person outside of work. I don't have to be the professional in my support networks. Workers with high caseloads. This was really high with compassion fatigue and burnout. Research talks about workers with the highest caseloads of survivors of violent and human-induced trauma, especially against children, seem to be at greater risk for compassion fatigue and the vicarious traumatization as well. Long work hours, long duty days, of course, not having good proper work-life balance. Those two kind of crossed each other. And then extensive caretaking responsibilities outside of work. So that talks about the provider that is responsible for patient care from 8 to 5, and then home, I am responsible again for everything outside of work. I just take care of a lot of people, and as such, it increases the factors of vulnerability. Any questions on the vulnerability factors? Anything in the chat box, Bonnie?
Yes, one person wrote, they think that clergy persons should be added to the list.
I concur. I did not see that in my literature, but I won't say that I didn't dig deep enough, because clergy indeed are experiencing with an ability to hold confidential, they're experiencing a lot of firsthand narratives of what's happening for their members or their congregation. So I definitely concur that first line religious leaders and clergy who are responsible for a large community of individuals with various lived life experiences are definitely at risk. I don't have any research to support it, but from my own lived experiences, I believe it. Thank you for that. All right, a few reflective questions before we move to our next. Have you noticed any of the aforementioned symptoms for yourself in your professional practice? Open dialogue. Wow. Who you guys working with that you're having these symptoms? Have you noticed any colleagues then, by chance, experiencing any of these symptoms?
Absolutely. I've noticed my colleagues will get like more, I can tell that they're experiencing some of it when they get shorter, even when their interactions with other of us within the practice or the clients. They kind of carry themselves differently.
Mm-hmm. Mm-hmm. You know, I think this is kind of like vicarious trauma, compassion fatigue, and burnout, all the whole gamut of it. It's kind of like an elephant in the room, I think. I think we kind of take on this oath of professional practice and delivery of services because we care, right? And that is great to have compassion satisfaction. But I think as we continue in this work, it's difficult to admit that I do feel something. But I think that is the cornerstone and the foundation of good professional practice is when we ourselves can admit and take a step back and turn eyes inward to say, hey, what's happening with me? How would you support or intervene with a colleague that you may see this with? What do you all do? If you see it or if you've ever seen it, what do you do?
I think this is Yolanda. I think being available to talk with them, to let them know that you're here to listen if they need to talk, just sort of being supportive if that's something they're interested in.
I like it. I like it. Any other thoughts?
I'm thinking at my job that I was at, and it was kind of just a running joke around the office, but we would do happy hours every Thursday after work. Mm-hmm. And I think, honestly, alcohol and being able to talk about it was the way that we sought support and intervention.
You will not catch me on video authorizing us to go turn up. However, I think that collegial support, we talk about the need to have safe spaces to lend ear to when we're experiencing things or when the people around us are experiencing things. I think that's a perfect way to say, let's connect outside of work and unwind and let's just talk, right? I'm here for you. Do you all find it difficult to do that? Anybody find any difficulty approaching a colleague and I'll just add a spin to it. My colleague does not recognize that they're demonstrating these symptoms?
I usually, when I experience things with a colleague that I would offer support, but I also would give them education on EAP, that they can do EAP services and what the services entail.
Okay, I like it. I think, when we think about this and the work that we do, when we're in agencies together, we kind of recognize and know when someone has a large caseload or when someone appears different. I like the idea that you're talking about offering support, offering education, and then offering a service. I like it. For you all, for helping professionals on here, how do you create a proper work-life balance? Or I guess I can ask, what is a proper work-life balance? What do you do?
For me, I like to make sure I get a proper social aspect, and I like to go to the gym. I like to work out. So I try to make sure I have a healthy balance of that, because we tend to work long hours, take on a lot of stress during the day from other people. And so a good outlet for me is to just exercise and let it all out.
Okay, I like it. Any other thoughts? I hear exercise, physical agility. Yeah. Any other thoughts? Create work balance.
I do a lot of yoga and exercise and meditation as well. And I also have like artistic things I like to do. But I definitely find it more difficult managing the work-life balance while working at home during COVID. It's definitely been a struggle, more of a struggle to kind of put that pause and that boundary on where home and work meet.
Okay. And we are certainly going to look at that, because everything that we would say to do to create work-life balance The gym is closed. The massage parlor is closed. The nail salon is closed. So all of the things that we would normally do, we've been forced to shift our direction. And then our spaces that may have been ours are suddenly an office space or a classroom. So I think it's important as we shift to whatever new norm looks like, that we're still intentional about finding ways to create an outlet that lets me shut off work for duty day. Any questions from the reflective questions?
Dr. Phillips, it's
Yes, ma'am.
Bonnie. One of our guests who is unable to unmute her mic, we figured that out earlier, has written that work-life balance is easier to attain the longer you are in the profession.
Mm-hmm.
And she recommends the Calm app.
Yeah.
And another person recommended the Calm, capital T, capital C, the Calm app, exercise, aromatherapy, and that's all. We had a couple more comments around the EAP, wanting to know what that stood for, and a number of people responded saying it's Employee Assistance Program. So that's it for the chat box.
I like this team. I need to say that. I like this group. I like the vibe in the classroom that we're taking care of each other. Absolutely. I love the Calm app. I love all of the mobile apps. There is actually, I think I included it somewhere in my slide in self-care, but there is actually a COVID-19 app. It's called COVID-19 Coping. It was developed by the VA and DOD. I am not dropping a plug for them guys, I promise. But it is an awesome app to just kind of record some of the stressors that are happening right here in the middle of a pandemic. So I like that app. Thank you for that. All right, we can't talk about vicarious trauma without talking about compassion satisfaction and compassion fatigue. We talked a little bit about compassion fatigue and what it is before I get to the formal definitions. What do you all think about compassion satisfaction? Is that a thing? And if so, why? Hello, hello, hello. Compassion satisfaction. What do you all think?
I've never heard of the term, so I'm interested.
Okay. Anybody ever heard of compassion satisfaction? Anybody ever heard of compassion fatigue?
Yes.
All right. I'm going to teach it. Here's the terms defined. Beth Stam, who I'm talking about, who we're going to look at later on, we'll look at her compassion satisfaction survey on professional quality of life scale. She coins these terms, compassion satisfaction, where we look at positive aspects of working as a helper, right? How much do I like my job, right? I think when we all first get into this profession, we are ready to go, and I'm here to serve. I signed up because I love this. I love working with people. I love seeing the outcomes, and it looks at and measures what's positive about the work that I do, all right? Compassion fatigue, on the other hand, is the negative aspects of working as a helper. And then burnout is the inefficacy and feeling overwhelmed in the work that I do. So these terms, you'll find somewhere people use them interchangeably. However, they are different, and they overlap, but they mean different things. So we'll look in our work today together how these terms differ and how they show up in the work that we do. So compassion fatigue refers to the profound emotional and physical erosion that takes place when helpers are just unable to refuel and regenerate, right? This is where we know a vacation is needed, but however, I just can't seem to catch a breath or a break. And as such, compassion fatigue has been described by Dr. Figley, as the cost of caring for others in emotional pain. So similar to vicarious trauma, except on vicarious trauma side, vicarious trauma, there's a profound shift in the worldview, that occurs in helping professionals when they work with clients. So vicarious trauma, the schema of our thoughts about our work change. With compassion fatigue, it's the cost of caring. It's kind of a residue of ouch of working with people. And vicarious trauma help us notice that their fundamental beliefs about the world and the work that they do in the world are altered and possibly damaged by the repeated exposure to traumatic material. So kind of feel the same, but very different in terms of how they manifest. And burnout versus secondary or vicarious trauma. Burnout is the work-related hopelessness and feelings of ineffectiveness at the work that I do. Both of these share a negative aspect, but burnout is simply just what it says. It's about being worn out, where secondary trauma is about being cautious, afraid, and uncertain of the work that I'm doing. Any questions on the variations between those? Anybody with any experiences? Going back to our reflective questions, anyone with any experiences on the two?
Well, I have had the experience of burnout, and I probably secondary trauma as well, because I was working at a facility that I had to do counseling sessions with people who had high levels of trauma, and I didn't recognize it, and I ended up with chronic medical conditions because of me not taking care of myself and my health pertaining to taking care of others. I worked long hours, I overworked, and I didn't have a life balance. It took until me getting a mentor, which was my college professor, who helped me realize and understand that I needed to have a work-life balance in order to function in the field.
So everything that we talked about in terms of those symptomatic slides and its impact to the psychological and physical health, sounds like that's what you're talking about happened to you.
Yes, yes.
Absolutely. With secondary trauma, it is, again, the exposure, the exposure of the constant hearing of the stories that's changing the way that I feel about my work. Whereas burnout, again, I'm worn out, and I just don't believe that what I'm doing has any impact. And as such, my affect and everything around me is negative. If we think about, because I heard you talk about, I wasn't sure and I needed a mentor to kind of point this out to me. Earlier, when we were talking about the vicarious trauma and people not really being aware of it, is there any difference with burnout? Would you all approach it any differently if you saw a colleague or a coworker demonstrating these symptoms? Would you still approach them in the same fashion?
Yes, I would.
Okay.
I do it all the time with people that we help each other. Like with you should be leaving early today, but right now I'm working from home because of my medical conditions. But when I'm in an office, we do it to each other. I thought you said that you was going to leave at such and such a time. Why are you still here? So that type of thing, to make sure that we're making sure that we're following through what we said that we were going to do, and not work long hours or overwork.
So the accountability partner. Is anyone noticing, just with the changes from COVID, and I'll push it all the way back, and I'm going to ask this question after the break when we actually conduct the ProQual scale, but is anybody noticing any changes within themselves about how they feel about work with COVID-19?
I feel like it's been harder to help others during this time, because it's like there's not much you can recommend because there's nothing open. There's only so many new hobbies somebody can pick up, only so many new things you can suggest for somebody, until it's just like, well, we got to just deal with what's going on. Like, we have to find normalcy in this new world that we're getting ready to enter.
as that truth unfolds and continuously builds to be potentially our reality for some time, what impact is that having on you as a worker when you're saying, hey, I don't know what to tell people? Because
it just made me feel like it made me feel like I just didn't know. It's like, well, I'm not doing anything myself, so I can't recommend anything to you because I'm not doing it either. I'm having the same emotions you're having throughout this whole thing. And then going to work, it's tiring. It's like, what more energy do you have? Like, how much more energy can I exert? Because I feel like my energy has been depleted throughout this whole time.
Mm-hmm. I think you bring up a really relevant point because the work that we do every day can be taxing just because, right? We're dealing with some very critical, vulnerable cases. But when we are living and thriving and trying to still survive in the middle of a pandemic with the exact same shared experiences as the clients and the families and populations that we're taking care of, I think it becomes a heightened responsibility for us to ensure that we are balancing our work, play, social life in a way that we're taking extra precautions to take care of ourselves during these times, because it can easily cause you to feel as if I'm not doing enough when there's no more to do. Anyone else with any thoughts about burnout and secondary trauma or compassion fatigue during COVID-19 social distancing guidelines? Anything in the chat, Bonnie?
I feel like a lot of times I get joy from like being with students like in person and like seeing their growth that way. And like through online teaching and just interacting with students online, there's less joy and just like more stress, and echoing, I don't know who just spoke, but the same sentiments as that were just shared of like not being able to give students productive ways to take care of themselves, not knowing what to say.
What is that making you feel?
Pretty ineffective. And just also, I know that students are anxious about what next year is going to look like. And then I'm also anxious about it.
I think again, and thank you guys, thank everybody for their transparency. I think it's really important when we're looking at burnout and the content of this entire training today is for us to take care of ourselves, right? As I stated when I started, this is a training that's for us, about us, and how do we take care of ourselves. And the mere fact that you guys are coming out with honest disclosures about where you are in the helping schema of things during this COVID-19, I think the honest self-care is going to be to stay honest. We're in an unknown time with the biggest pandemic that I've never experienced anything like this. So being able to take care of ourselves in helping circles, to understand when I'm effective, what's in my scope, what's in my power, and what's in the realm of control, not just for me, but for the people that I'm trying to take care of. Because if we spiral into a negative headspace over the truth of what we do not know, then we feed ourselves a group of negative cognitive schemas that aren't they're just untrue. Does that make sense? All right, so we are just about at break. Any questions from any of the content that's been shared thus far from the before break slides? Any questions? What I would like.
I just wanted to make a comment. I think that it was very imperative and important what you said about being honest. That's the only thing that we can do as helpers, to be honest in a counseling sessions when we're talking to the patients, and being in reality so that they can understand, that everybody will be on the same page about the pandemic.
Yeah, I think it's important for us to be honest with our consumers and to extend grace to ourselves. And when I say extend grace to ourselves, I'm speaking about operating from a professional realm in spaces that we've never done. right? All of our training and everything that we talk about with when we're encouraging self-care is usually somewhere centered in the environment. And we're shifting to where the environment is not where we need you to go. So now how do we flip and figure out a new way to cope and function in our norm where our own self-care is on the table as well as the people that we are required to provide a service to. All right, guys, so here we are at our break slide. Here's what I need for you to do. I need you to stretch, hydrate, grab a snack. We got like 15-minute break, but in this 15 minutes, please come back with a piece of paper to be able to calculate your scores. We're going to go through the professional quality of life scale together after the break. And I'll need you to have a calculator, unless you're good at math and you don't need the calculator. But then we'll talk about that and kind of measure where we are on a compassion satisfaction scale and compassion fatigue and vicarious trauma. Any questions before we break?
Do you want to mention what time we're getting back on, please?
It is 2:15. Let's be back at least by 2:32. No, actually we're a little early. It's 2:10. So let's be back on by 2:30.
Thank you.
Okay. Bonnie, what we got, like 1 minute?
Hey, Dr. Phillips, how you doing? That was a nice break.
That was a nice break. So I'm kind of scanning. I think you caught everything, Bonnie, but I'm scanning through the chat to kind of see did I catch everything and did I get everybody's story or experience. I see in here a lot. I think I see it 3 times where everybody's talking about the difficulties with COVID-19 and still trying to manage and balance. So we talked about that some, but I want to open back up when everybody gets back. I guess we can go and get started. It's 2:30, but just recognizing how COVID-19 created a very quickly, rapidly changing landscape for healthcare professionals and patients alike. And with this training being about help for the helper, and I probably stated this all throughout, but I'll keep saying it, it's really important that we stay on the lookout for the burnout and the compassion fatigue and the decreases in compassion satisfaction, right? Our workspace and home space and play space, they all suddenly have blended together. So I think it's what I mentioned before we ended, to extend yourself grace if you're feeling these things, simply because we didn't work this way 6 months ago, right? We didn't work this way a year ago. And worked this way 5 years ago. So it's really important that as we learn today and as we discover together and we really kind of checking off and checking the box and looking at ourselves, that we extend ourselves grace and we elevate the self-care and the social support and the social networking to increase our flexibility and resilience with being able to survive and thrive through a pandemic and very trying environmental times. Any questions? Everybody doing okay? Check in. Everybody all right post break? Veronica said mentors are so important. Yes, yes, yes. Work-life balance is much more difficult. We just covered that and talked about that. All right. So the next latter portion of our time together, we will continue to focus at the all 3 elements that we talked about. Well, 4. Compassion satisfaction, compassion fatigue, vicarious trauma, and burnout. Sorry, I had a mental fog. Burnout. We'll continue to talk about those. I have a brief YouTube clip that I wanted to add in just to kind of highlight some of the things that we've already talked about. And following the clip, we'll go into the professional quality of life scale. So you guys got your paper and pen and pencils and brain or calculations, and then we're going to ride right in together. Any questions for me before we pull the video? All right.
I'm used to taking care of people who are struggling, but sometimes I feel like I can't do it anymore.
Some days are better than others. Today I felt anxious and nervous, and I couldn't stop thinking about my patient's suffering.
Am I even making a difference?
Dr. Phillips, I don't know if it's me, but I can't see anything on the screen. We see the YouTube screen, but not the PowerPoint.
Yeah, I only have the PowerPoint showing. Can you see the video?
No.
We're facing a real data dilemma.
I'm sorry.
We're creating a...
I'm sorry. Thank you, Bonnie.
Maybe start over. I'm not sure why it's doing this.
Uh-oh. Hold up, guys. I'm sorry. These technical.
Yeah, it says full screen, but it's all white colored or gray and then partially gray.
Okay. Give me 1 second. Let's get out of here. We'll stop presenting that because that's not what I want you guys to see. Can you see the YouTube screen at all?
Yes, we saw the screen before, not this minute. We see you again, but before we did see YouTube, but we couldn't see any picture on a video.
All right, let me try it again. I'm sorry, guys. I don't know why it's not playing directly through the PowerPoint for some reason.
Can you have it separate at one time?
Yeah, I pulled it up separately in the YouTube clip, and that's what I was trying to share, but I'm not sure why it didn't play. But if it doesn't, I'm not going to, we're going to continue to proceed. We're not, wait a minute, 1 second. I'm trying to pull it up. Here it is. Let's do this again. Let's do this again. Everybody okay? Cannot see the video. All right, let's try it again. What do you all see now?
Oh, looks like it's coming. Here we go. We've got it.
All right.
I'm used to taking care of people who are struggling, but sometimes I feel like I can't do it anymore.
Some days are better than others. Today I felt anxious and nervous, and I couldn't stop thinking about my patient's suffering.
Am I even making a difference? After what he went through, I don't know if I can help at all. Maybe I should find another line of work.
She was so distraught. I couldn't take away her pain. I was absolutely exhausted after seeing her.
These are the voices of compassion fatigue. It can happen to anyone, but the people who seem to be most at risk are those medical and mental health providers who care day after day for patients who are struggling with significant symptoms.
Dr. Phillips, we have we have audio, but we aren't seeing anything. All we see is a title page, Psych Hub.
Find as absorbing the patient's suffering through the experience of taking care of that person.
Yes, we can hear it.
As a provider, empathy might be your most valued skill. It is also the same trait that can make you vulnerable to the experiences of your patients. And you might find yourself suddenly feeling exhausted.
Now we can see it.
Frustrated, or sad. Thoughts and feelings might become overwhelming. Cognitive abilities can be impaired. And you might feel completely lost where you used to feel the most confident. Providers are especially vulnerable when they are busy in their clinics or hospital schedules and find themselves prioritizing their patients over their self-care and connection with others. Any provider who cares for people with trauma histories can be at risk for compassion fatigue. Providers can protect themselves and build resilience by keeping a few simple things in mind. Be with other professionals. Social support among colleagues is a protective factor for providers. It allows you to feel connected with peers, as well as seek consultation or supervision, or even just the chance to vent in a professional and appropriate outlet. Isolation is a risk factor and a warning sign for compassion fatigue, and staying connected reduces its likelihood and severity. Choose optimism. An optimistic outlook is protective against compassion fatigue, as well as many stress-related health consequences. One exercise that promotes optimism is writing a gratitude log. Once a day, write down 3 things to be grateful for. It works. Make time for self-care. In a busy office, clinic, or hospital, you may only have 5 free minutes at a time. Use those minutes wisely to care for yourself. Everyone's favorite activities are different. You might feel best when you listen to music, journal, meditate for a few minutes, pray, or read. Any of these and others can protect you from the effects of difficult work. Compassion fatigue is a risk for any medical or mental health provider and affects the ability to provide outstanding care to your patients. Providers can be protected from the effects of this experience by putting a few simple practices in their day-to-day routines. The work is so important, and self-care is a priority. It's just good practice.
Everybody okay?
mother, wife, pilot. I am driven, sometimes funny, and
Okay, so I'll go back to sharing my video shortly. From the clips, you could not see the video at all. Can you all hear me?
We saw it.
Okay.
No.
From the things that were shown in the video, it kind of gave an overview of what we had already talked about. But with the prioritizing self-care, short pieces, something like that on and off. And I'm sorry, guys. Sorry for the technical cutout. The video ultimately worked. Thank you, Miss Elise. No. From the short clips that she provided with talking about the prioritizing of the self-care and protecting self from resilience and creating a gratitude log, is that something that you all are incorporating already or something that you're willing to put into your practice? I see head nods that I can't hear.
Yes. So this is Tiffany, and I mentioned how I enjoy the Calm app. I just noticed that one thing that they added was a new feature of gratitude. So at the end of each day, you can choose a different prompt, and you have the space to put in 3 different things that you're grateful for.
I can't reiterate enough. Thank you so much, Tiffany, for that Calm app. And I'm going to, I think, did anybody drop that already in the meeting chat?
Yes.
Okay. Yeah, I think that it's immensely important that we're taking care of ourselves. Let me pull my PowerPoint back up. Can you all see that slide?
Not yet.
Is it back in?
No. Did you do share screen?
I did. Wait a minute. I probably did not, but I thought I did. Yeah. Share screen. Somebody said the Calm app puts me to sleep every night. Awesome. All right, this should be coming back up now. Can you see the slides? Okay. All right, so that was the video slide, but again, the purpose of the video was just to kind of reiterate some of the things that we had already talked about regarding compassion fatigue and its commonness in helping professionals. What I want to move us into, actually what I asked you all to have your paper and pen for, is to be able to actually engage in the interactive activity that we're going to do. Well, we're going to do it together, but you're going to do it at home from your desktops, from your desk with your paper and pen. Really looking at the professional quality of life scale. I threw a few slides together to explain what it is. It's a scale that was developed by Beth Hudnall-Stamm to measure pretty much the compassion fatigue, satisfaction, and compassion fatigue. It is a 30-item self-report measure of the positive and negative aspects of caring, really focusing on the burnout and secondary trauma associated with the work that we do. And again, measuring the compassion satisfaction and compassion fatigue. Has anyone ever heard of this scale?
No.
Okay. All right, good. So we get to learn something today and do a little work together. The ProQual is the most widely used measure of the positive and negative aspects of helping in the world, helping in the profession that we do. It has proven to be a valid measure of compassion, satisfaction, and fatigue. With over 15 years in use, it has was developed with data from over 3,000 people. So it is highly used and highly recommended with good studies behind it to look at how it works. So here's how it works. I did, to keep from cutting up her content because we couldn't alter it in any way, I kind of just screenshotted each section, different sections into the slides. What I would like for you all to do, I'm going to read the questions, but I need you to put your number with your answer. So I don't necessarily need you to write the question, but write your number, because that's going to be really important when we go back to do the scoring together, that your numbers are with your answers. So the answer key is featured here from 1 to 5, 1 being never, 5 all the way to very often, and everything in between, rarely, sometimes, or often. So the critical nature here is to answer truly, and it's asking you to look at the answers from a 30-day scope, right? For the last 30 days, how have you felt about the questions? What I'll ask you to do, I'll spend a little time running through each question. You jot your answers down. I'll ask for a thumbs up or a yay or a yes, and then we'll move to the next. But we have 30 questions in total. Are we ready to go?
Yes.
All right.
Yes.
Yes.
All right, let's do this.
Yes.
All right, let's do this now. Keep in mind, we may be, because I was, to be honest, I was really surprised with what my scores were. But only thing I want from you is an honest assessment, and then we'll have some dialogue about where you are, and then keep it moving. Fair enough? So number 1, I am happy. Scale of 1 to 5, what's my number? Number 2, I am preoccupied with more than one person that I help. Number 3, I get satisfaction from being able to help people. Number 4, I feel connected to others. Number 5, I jump or am startled by unexpected sounds. Number 6, I feel invigorated after working with those that I help. 7, I find it difficult to separate my personal life from my life as a helper. 8, I am not as productive at work because I am losing sleep over traumatic experiences of a person that I help. 9, I think that I might have been affected by the traumatic stress of those that I help. 10, I feel trapped by my job as a helper. Can I move to the next slide?
No.
Okay. All right. I'll give a few minutes. And remember, the scale is 1 never, 2 rarely, 3 sometimes, 4 often, and then 5 very often. And we're only asking for a 30-day window for your ratings. Can I move?
Yes.
Okay. All right, the next set, same thing, still looking at 30 days, same scale, 1 to 5. Number 11, because of my helping, I have felt on edge about various things. Number 12, I like my work as a helper. Number 13, I feel depressed because of traumatic experiences of the people I help. Number 14, I feel as though I am experiencing the trauma of someone that I have helped. "15, I have beliefs that sustain me. 16, I am pleased with how I am able to keep up with helping techniques and protocols. 17, I am the person I always wanted to be. 18, my work makes me feel satisfied. 19, I feel worn out because of my work as a helper. And number 20, I have happy thoughts and feelings about those I help and how I could help them. I'll give a few minutes for you all to scan through with your 1 to 5, 1 being never, 2 rarely, 3 sometimes, 4 often, and 5 very often. Everybody okay?
Dr. Phillips, it's Bonnie. I want to mention, if I didn't say it earlier, I will be emailing the PowerPoint to everyone.
Okay, thank you, Bonnie. And I have this, a link to this actual survey is in the reference slide, which is easy to click on and open right up to the actual survey. Can I move to the next 10?
Yes.
Okay.
Yeah.
No objections to a move? Okay. All right. And then the last set, the last 10, number 21, again, same scale. I feel overwhelmed because my casework load seems endless. 22, I believe I can make a difference through my work. 23, I avoid certain activities or situations because they remind me of frightening experiences of the people that I help. 24, I am proud of what I can do to help. 25, as a result of my helping, I have intrusive and frightening thoughts. 26, I feel bogged down by the system. 27, I have thoughts that I am a success as a helper. 28, I cannot recall important parts of my work with trauma victims. 29, I am a very caring person. And then number 30, I am happy that I chose to do this work. Now I'll give a few minutes for you all to look over this last set of 10. Does anyone need me to go back to the previous 2 slides for the first 20? All right, you got all your scores in? Anybody anxious to see their results yet? All right, so let's look at how we score this, all right? You captured all of your numbers, and keep in mind we're measuring from 3 different domains. Compassion satisfaction, which means how well I like my job, how I like what I do. So again, the higher the number, the greater. For the burnout scale, we're measuring how you feel about your work. The higher the number, the more dangerous or critical it is for you to do some evaluation. And then the next one is, of course, the secondary traumatic stress scale. Again, the higher the number, the more concerned that we want to be in terms of examining what we're doing. Questions before we move to the scoring guide? All right, so in the next session, for the score, your task, you'll have to understand for the interpretation of it all. To find your score on each section, total the questions listed, and I'm going to have the slide up to help you be able to determine where you are on the scale. So for compassion satisfaction, all of the questions, although they were grouped in 30, all of the questions for the scoring of them, we have to score them by the numbers listed here to find your compassion satisfaction scale. So your score for number 3, number 6, number 12, number 16, number 18, number 20, number 22, 24, 27, and 30 will be total sums to determine your compassion scale. Does that make sense? Anybody have questions about that? I'll give you time to score all of that up to see where you are on compassion satisfaction. Everybody okay with their math work over there? Now, if I move on to the burnout scale, now the burnout is a little different. We have a key that we have to translate for the burnout scale. Burnout numbers are 1, 4, 8, 10, 15, 17, 19, 21, 26, and 29. If you look at the questions, the ones with the small asterisks by it, you would follow the key to flip your scores. So for example, for number 1, if your score was a 2, you would change that to a 4. On the burnout scale, you need to take an extra step. Starred items are reverse scores. If you scored the item 1, it would be a 5. Does that make sense? Told you all when we started we would be doing some uncomplicated math, but nevertheless adding. I'll give you all a few minutes to kind of tally that up. This one is a little more complex in terms of flipping those scores. And again, the example of why the scores are flipped is up here in the scale. She asked you to reverse the scores because the measure works better when these questions are asked in a positive way, so they can tell more about the negative form. Can we move to the next set?
No.
No.
All right, I'll give some time. No rush. We still have time.
Mm, 11, 12.
I asked you all when we started to ensure you had paper, pen, calculator, fingers, and toes if needed. So here we are. Everybody doing okay? Doing a quick check-in on the burnout measure still. We okay? Checking in again.
Yes.
Yes.
All right, I'm gonna move. I guess you guys are like, who comes to a training and do math? We're measuring burnout. All right, here we are with the final scale, the final score for the secondary vicarious traumatic stress scale. The remaining numbers that have not been scored. So 2, 5, 7, 9, 11, 13, 14, 23, 25, and 28. And again, the higher the number, the more concerning. So go on and sum those up. By now, after this one, you should have 3 scores. Kind of see where you are. Everybody okay? So I want to hear from you guys. Is anybody surprised with what they're finding? We're talking about compassion satisfaction first. How satisfied are you guys in the work that you're doing?
Tiffany here. So I'm not surprised simply because I left my previous job within the last 30 days for these exact reasons. So I assume if I had done this about the previous 30 days, my scores would have been higher. But I recognize that they're significantly lower since starting this new job.
Okay. Tiffany, do not leave this training and go tell your employer that you must quit because of this. No, I'm joking. I'm joking. Anyone else, any other findings that you're kind of like wowed or this makes sense or I didn't know? Any discoveries from this completion of this?
For me, my scores are average, so I've done a lot of work since 2016 on excuse me, on working with recognizing burnout, compassion fatigue, and secondary traumatization, and using the coping skills that I've learned from different training programs to help me with maintaining balance, work-life balance.
Awesome. This is again, this measure is not about to fix or to cure. It's more about being able to identify where I am and have an understanding of what's dangerous and then knowing where to move into what I need to do differently to best take care of myself so I can continue to practice in the helping capacity that I'm in. So I'm excited. I'm excited that you guys are having these discoveries and pretty much doing well. Was anybody's score lower than you had expected?
Can we go back to the compassion one? I missed the scoring for that.
All right, no big deal. Wait a minute, let me move back. That one, the first one, there it is. Compassion, the compassion satisfaction or the fatigue?
Yes, this one. Yeah, compassion satisfaction. Okay. Thank you.
No worries. I can tell you, I was surprised with my own score, but I will ask you all, do you believe that post-COVID, I mean pre-COVID, I'm sorry, pre-COVID, do you think your scores would have been different or about the same?
Pre-COVID, I think they may have been higher. I think kind of being home has allowed me a little downtime.
Okay.
To kind of recollect. So possibly prior to COVID, they may have been higher.
Okay. Is anybody differing in their thoughts about this? For me, I was really surprised because I thought my burnout number was higher. I thought I was burnt out, but according to the scale, or unless I didn't do it right, I was pretty low. So did anybody have any surprises with their comeback scores? Okay. All right, I like it. How are you all feeling? Just checking in. Everybody still with me?
Yes.
Dr. Phillips, it's Bonnie.
Yes, ma'am.
You may want to take a look at the chat box, please. There's a few comments in there.
Okay, wait a minute. How do I get out of here to get over there? Hold tight, guys. I'm coming. Okay, so jump up. I'm sorry. Should we add up our scores? Yes, did that. Elise, was your question answered, Elise, about if we're done, should we add up our scores? I can't hear Elise. I missed the low.
Elise is the person who can't use her mic.
Okay.
So that was early on in the conversation. I think I just wanted you to look at the later ones, please.
Somebody is saying they're burnt out. With compassion and burnout, I'm not surprised, but satisfaction was surprising. What was surprising about the satisfaction? Who wrote that? I don't want to try the name and totally tear it up. But someone wrote that with compassion and burnt out, I am not surprised, but satisfaction was surprising. And here, I'm shocked that I scored low on burnout. Same with me. I confess that. I thought that I was burnt out, but the way that I scored was pretty well. Elise said feeling good. Demetrius, yes, feeling okay. Low scores. Okay, was this helpful for you all to begin to really look at where I am on the, in terms of risk for my burnout, my vicarious trauma, as well as compassion satisfaction? Was this helpful? Could I see the burnout scoring page? Somebody's asking for the burnout scoring page. With the burnout, are you asking about the numbers? Because I can tell that, so I don't have to go back to the slide. For the burnout scoring scale, 22 or less is low. Between 23 and 41 is pretty average. The average score for the average is 50. 57 or more is pretty high for burnout in those numbers. And again, the slides will be sent to you, as well as on the end of my slides, there is the link for how to click and directly go into the scale. So again, intent for that was to be able to look and assess as to where I am. With the compassion satisfaction, somebody said they were surprised because they may feel different. But those questions, again, are designed to kind of help you look at and examine the why, you know, and I think we lose that. When we're doing hard work, we lose the why behind the work that we're doing. So compassion satisfaction kind of reminds us of, hey, this is why I'm here. All right, I want to talk a little bit in our next slide about the impact to professional practice. Each of these, I'm looking at now holistically the total sum of what we've been talking about. The vicarious trauma, the compassion fatigue, the compassion satisfaction, and then the burnout. And these are just a few sample examples of things that could potentially have both positive and negative aspects in our professional work. So we know with burnout, compassion fatigue, vicarious trauma, all of these things can increase the risk of changes to our insight and judgment. If our insight and judgment changes, then there is an opportunity for malpractice, mistakes, or things in terms of our competence and our judgment of what we're doing with our patients or clients. So we want to really be sure that we are doing good quality self-analysis of where we are on the gamut of compassion fatigue and trauma burnout. Continued work satisfaction is a result of the compassion satisfaction scale. When we have good balances and we're averaging in low or average ranges for these things that we've talked about, there's an opportunity for us to continue to find joy and quality in believing that the work we're doing counts. Diminished levels of competence. If I have a negative idea about what I am doing and the value of what I'm doing, chances are I'm not constantly polishing myself or learning new skills or seeking supervision or seeking consulting, higher education opportunities for me to continue to develop as a professional. So then I could essentially lose my level of competence. We take the risk for boundary violations. When we're burnt out and tired, we potentially are not crossing all T's and dotting every I, and it increases the risk of losing and enmeshing with our clients beyond a professional scope. Diminished productivity. Clearly, if I'm tired and burnt, I'm not as effective as I once were. A good quality of compassion satisfaction is potentially good client outcomes where we can actually see the value in the work that we're doing. Negative aspect, ethical violations, kind of crossing over into those boundary violations and competence. It puts us at risk of ethical breaching our code of ethics. And then potentially the most harshest aspect is we put ourselves at risk for professional sanctions and being in trouble with our licensing boards or supervisory aspects of those that have authority over us. So I think it's immensely, I'll continuously say it, for us to continue when we're doing this helping work, that we have good work-life balance and good self-care skills to balance out so that our practice is not impacted with the people that that are entrusted to us and with us. Questions on that impact slide? Uh-oh, why is that there? I'm sorry, I went backwards. So here's some reflective questions, and we kind of started this discussion, but I want to have a little dialogue around it. How has the mandated changes related to COVID-19 had an impact to your professional practice over the last 3 months? What's different for you versus February? What's different for how you work?
So I'm not doing any face-to-face sessions, and I feel like that's a big difference in holding sessions through Zoom or virtual. I feel like I'm not connecting as much as I would if we were face-to-face doing sessions.
Changes in connectivity. Anybody else? Changes in your delivery of care. What's different for you? Is anybody liking the aspect of virtual platforms over face-to-face?
I have. I definitely will say that that's something that I've grown into, because at first I absolutely hated it, but I think because I've now gotten into a groove, it's something that I look forward to, because it's also freed up a lot of time that I can now fill with other things that I wouldn't have had because maybe I was commuting or in the car or just trying to run around.
And these factors, I threw this in here in terms of a reflective question, just to kind of jog some idea and some dialogue around what potentially do I like about this? Are all aspects of what has changed for me in COVID-19 negative, or can some of this lend to compassion satisfaction? And if I think about, I no longer drive and deal with traffic to take care of my patients, I can do that in my home. Does that change my satisfaction in the work that I do? Does it increase my burnout because I'm overwhelmed? Like, what does this do for me on the realm of looking at my where I fall in the compassion, burnout, and secondary stress reaction? How about the symptoms? Have any of you all noticed the symptoms that we talked about in just the last month? I want you all thinking about this. And if so, how are you addressing these and making sure that you prioritize your self-care? Right? This changes in our work duties could very well, for some, again, going back to what trauma does. For some people, it's traumatic. For some people, it's a breath of fresh air. So depending on where you're falling in terms of your helping work with others, it will determine where you fall and what you look like in these scales and these measures that we're talking about.
Actually, Dr. Phillips, can I add one thing?
Yes, ma'am.
I know that specifically it says COVID-19, but I definitely want to take the time to reflect on, I've noticed symptoms of vicarious trauma as a result of like the social injustice around like George Floyd, Black Lives Matter, and attempting to hold space. More specifically for my white clients, I've definitely noticed that I'm having a lot more difficulty in that realm, but also attempting to show up and be there too for my Black clients to be able to talk about the trauma too that they're experiencing as a result of what they're witnessing.
I was hoping somebody brought that up. Is anybody else running into that? Because this is very well the very first question that I kind of asked you all when we first started in our dialogue and the training. I asked what types of trauma narratives are showing up in your spaces and who's affected and what populations are affected. So tell me your name because I can't see the chat box. I couldn't see who was talking. Who brought that topic to the floor?
Me, Tiffany.
Thank you, Tiffany. In terms of the impact that it's having to you, what does it feel like?
I would say 2 weeks ago, it was really heavy. I definitely knew that in between sessions and after sessions, I was noticing myself crying a lot more. I felt very angry, irritable, heart racing, sweating. So kind of all the things, just checking them off.
Can anybody else relate to that? If we think about what has happened in America in a 90-day window, right? In a 90-day window, we've seen and witnessed an awful lot of scary events, many resulting in death. And again, as I stated, when I started developing this content, COVID-19 was just beginning. So that seemed like the very thing that was a huge trigger for shared experiences with trauma narratives and constant deaths of people and grief associated with it. And then we piled on top of it some social injustice and inequities in communities with an awful lot of violence. Has anybody, in terms of the helping profession, have you all taken a step back and looked at how to take care of yourselves during times of crises? And that's what we're talking about with reflective question 2 here. Have you noticed any of these symptoms in the last month? And this topic, I shared this when we first started, this topic often feels like an elephant in the room. And it's really a difficult conversation, but if we're going to be effective in our work, we have to start having these conversations and really looking at what does my self-care guidelines look like. Every professional organization, for me, is NASW. Our professional organizations and our guidelines always talk about and enforce, actually, self-care. So when we're looking at this and we're really reflective and examining ourselves, I would encourage you all to make sure that you have safe spaces where you can actually release whatever your stance is and wherever you are in terms of dumping your own anxieties as well as those that you work with off so that you can continue to pour and take care of others. Thanks again, Tiffany, for your transparent dialogue with where you are with this. I think as we begin to tie up this training today, and I used a knot intentionally, twisting everything that we've learned together about compassion, satisfaction, burnout, compassion fatigue, I think probably the most complex thing for us to do is to just pause and make room for self and be kind and gentle to ourselves. So I wanted to go through and talk a little bit and actually hear from you all before we end this time together today. I want to hear about your self-care plan. I gave some strategies, but what I would like to hear from you after this slide is, what is your plan for how you plan on intentionally pausing to do something for yourself? So here are the strategies that I kind of pulled from a little bit of research and literature, as well as what I do for myself to stay sane. It's really working to work-life balance. And if that means cut my phone off, make myself unavailable, even during some duty days, being clear that I need a lunch break, and I'm going to take my lunch break, and my lunch break will not be at my desk. Rather, it will be outside with me walking or me cutting some music on and putting my head on my desk or whatever. When I am at work, still maintaining a balance for when I feel burnt and where I feel the stress. Same for home. When I'm home, trying to find balance for life. Someone talked about journaling earlier, being able to really have a safe space for yourself that belongs to you. Please be kind to yourselves and value the work that we do, and believe that sometimes we need it as well. If we need to seek therapy, please gift yourself a therapist. Exercise, physical activity, whatever that means, whether that's yoga and meditation or running and lifting, whatever your exercise outlet is that you need for yourself to build a self-care routine. Start thinking about ways that I can include this in my busy schedule. Please, please, please take leave. Some people like to save their leave. I still haven't figured out why. But if you have accumulated leave, use it. I hear a lot of people talk about staycations. They're nice, but I believe in a vacation, and that means get away and do something different. But if you have leave, balance it out and take some time. Music, of course, there's a lot of literature that talks about the benefits of music to the soul, calming effects of music. And then again, hobbies. I know that we're limited with what we can do in terms of COVID-19 and what's going on in our environment, but take time to do something that does not feel like work and strain on the brain, so that you're being kind and graceful to yourselves. So I would like to hear from you all before I move to the next slide. No, I'm sorry. There was another continuum. Avoiding additional stress. Sometimes we are the go-to for people in our personal lives, and if we are at overload with those that we work with, we might have to be able to say no to people, really just setting good boundaries for ourselves. Being honest about what you are experiencing. I almost feel like it's impossible to turn the news on and not get angry, hurt, sad, or affected in some emotional realm about what's happening all around the globe. So be honest with what you're doing, and if you need time out, take it. Make sure that you have a strong peer support group, both professionally and personally. Get rest, seek counseling. Again, that goes back to that same therapy, and then of course supervision. So I would like to hear from you all. I would like to take about 5 minutes of our time to hear, what is your game plan? What is your way forward for your self-care to kind of balance out? If you're on average, good, but how do you move from average to low on what you found from your measures from the SAM scale?
I think for me, it's going to be taking my vacations again. With COVID going on, I have not been able to take a vacation in 3 months, and that's very unusual for me. I usually like to take at least one trip a month, whether it be just a weekend vacation, just to get out of Maryland, to be around family and friends. So definitely looking forward to being able to travel again.
I like it. I like it. Anybody else? What's your promise to yourself?
For me, it's going to be to get some rest, because I just feel like mentally exhausted with the COVID stuff, with the social injustices happening and all of that. It's just exhausting. So for me, it's going to be just really getting some rest and taking some time for myself.
Okay, I like it. Any other thoughts? Anybody else?
I think for me, it's going to be just putting that boundary in place between working at home and when it's time to cut the computer off, cutting it off, and saying goodbye to work.
Okay. So setting some balance.
Yes.
Boundaries. Okay, I like it. Any other thoughts?
Mine is avoiding additional stress by taking on additional jobs.
Okay.
Dr. Phil, go ahead. I'll wait.
I didn't add to this, but one of the things that I would encourage also is to be very mindful and limited about your social media exposure or news exposure, right? When we think about vicarious trauma, it is because we're seeing things or we're hearing things. And in the literature, of course, it's dealing and directly looking at our patient care and those that we treat. But sometimes the media outlets become immensely emotionally draining with the content that's there. So if I'm already at a high threshold of burnout, adding more content into my schema of things is not going to help me to lower that number. So when I'm thinking about self-care, it's important to unplug, if that's possible, to just unplug, because some things are just toxic and debilitating to whatever energy that we have left. Bonnie, you had a thought?
I just was going to review a couple things in the chat box.
Okay.
One person most recently did say that turning off the news has really helped with decompressing.
Yeah.
Other suggestions, one person said that some people don't use their leave time because they might need it if they get sick. Other people suggested ways to take care of themselves. One, take time off. Another person said, spend more time in my garden. It feeds my soul. Another person said therapy, mindless TV, taking time off even though I have nowhere to go, taking drives and looking at the sights around me, spending time with my son and husband, sitting outside more, making time for me. Another person said go on vacation. And the final one is I also garden a lot. Thank you.
Like it. It sounds like you guys get it, and you're creating spaces of mindless activity. Right? If we are really honest, there's not going to be a way to fully escape stress or trauma, because it's just happening all around us, and it shows up on our couch or at this point on our computer. When we're doing this work, it's going to show up. And our job is to keep ourselves at a healthy balance where we're not necessarily consuming. There's a concept for self-care with dealing with trauma around resilience, right? Post-traumatic growth and resilience, and how I take care of me, even in the middle of being a frontline hit for other people to take care of other people. So from a resilience perspective, and I did not put this in my slide, I should have, so on my notes, so I'm sorry, I'll add it before I send it out. The resilience is the power or ability to return from the original form or position after being bent, compressed, or stretched. It's positive adaptation to stress or trauma, right? So when we think about resilience theory of growth and learning, it talks about the ability to still function in spite of all that I'm taking on or in. And our self-care is a component of how resilient we are. Our networks and our social supports is an aspect of how resilient we are. Our ability to have external networks and strengths, to include our own character strengths, are a psychological force and a protective factor for us to survive and thrive and protect us from vicarious traumatic experiences. So we are way ahead of our time and our schedule. So I do want to hear, I heard you all talk to me about your self-care routines and your self-care strategies. But what I wanted to go back to and spend a little time with, and before we get to question and answers, is looking at the, going back to a reflective question. I'm sorry, I'm backing my slide up. I'm backing my slide up because I want to ask you all about the definitions. After you've done the compassion scale and the satisfaction scale and the burnout scale, going back looking at the coined term for vicarious trauma, how likely do you believe it is right now with what we're living with right now? How likely or how high risk do you believe you are for encountering a vicarious trauma reaction? Interactive folks, any thoughts? I want to hear what your thoughts are about what we're living with today in terms of your ability to be resilient. Do you think it's highly likely, or do you think you can stay somewhere in the low realm of compassion, and learn low realm of burnout and trauma? Vicarious. Need to see y'all faces.
I think it'll require being intentional, but I definitely think it's possible.
So being intentional with self-care?
Yes.
You know, I documented here in my closing slide, I documented that, you know, in order for us to be intentional, it's important that we give ourselves the same care and attention that we would give to others, and then we watch ourselves bloom. So I heard somebody talk about gardening. Who is that person that's talking about gardening as a part of their own self-care rituals and self-care routines? You know, are we doing new things that we've never done before to manage how we are thriving and surviving? So that's going to be, I'm stop sharing. I know patience, I'm sorry, I'm in here. Somebody said I also garden a lot. Photography, I garden a lot. I really have to focus on you and putting you first. Is that a difficult task? Right? When we're trained, we think about us as professionals, we're trained to take care of others. We're trained to take care of and provide for others. Mm-hmm. And in the process, it's easy to lose ourselves. Right. So when we're tying all of it up, we talked a lot today about self-care rituals, self-care routines, and what they look like. I want you all to hold these definitions with you so that you are aware, right? And knowing when I need to take a break. So we have probably about 15 minutes of time together for us to fully reach our 3 hours. And I am through the slide content, the slide deck. They will email you all the slides. I want to open this floor up this time for Q&A. Is there anything that was presented today that you all have dying, burning questions on, that we can spend our last few minutes together answering those questions or comments? I'm scanning back through the comments. I love sleeping in. I prefer face-to-face. I think I've covered all of the content. I would encourage you all, maybe every 40, because it covers a 30-day window for the Beth Stam's pro crawl. Maybe try to do that. I would suggest maybe twice a year just to see where you are and knowing again where my self-care can increase, where my supervision can increase. Does everyone here have access to supervision?
I don't. I'm a supervisor and I really don't get supervision like I think that I should have. So that's why I venture out and reach out to mentors. I did have a supervisor when I was working at one of my jobs. I no longer work there any longer. So I'm not getting the supervision that I would need to help me to supervise other people. And most of the things that happened when I spoke earlier was because of supervision, where the burnout came into play and the trauma and the compassion fatigue, because I was trying to help counselors help patients, and it caused a lot of issues with me. So that's where I had to get the mentor. But that's what I'm in search for now, and a new mentor to help me be with my professional development.
Supervision, mentorship, peer supervision, scholarly collegial supports in safe zones where we can be authentic. Right? I think a big issue. I've been referring to compassion fatigue and vicarious trauma as like the elephant in the room with helping professionals, because for some reason it's seen as a personal scar. You know, while I'm not recommending that it becomes the badge of honor or the quality of our work, but however, we have to be honest enough to be able to acknowledge when I'm tired and when I'm not feeling satisfied with the work that I'm doing, or when I am affected by the stories that I hear. But if we have nowhere to go to be honest with that in terms of higher echelons of supervision, then we take the risk of holding it all. And as you stated earlier, ma'am, you talked about having physical symptoms and actually falling totally out of the way. So we want to avoid that. I want to encourage you all to just take pause to examine what's happening with me and where I fall on this. And it's not an easy job, right? The work that we do every day, contrary to what anyone says, it's a mental job. So anything that requires cognitive agility can become taxing and tiresome. So I think just want you all to give yourselves a hug and space and grace to be well and stay well. Questions, thoughts, closing, dying concerns, any at all? Miss Bonnie?
Okay, well, I hate to leave early, but it looks like it's time. So I thank you very much, Dr. Phillips, and I thank all the people who attended, and we had a good workshop today. Thank you.
Okay, self-care is not selfish. I'm putting it in the chat that self-care is not selfish. It is necessary.
Also, go ahead.
I'm done.
I was going to say, I'll also repeat again that next week people will be receiving 2 to 3 emails from BHSB online. And those emails will be a sign out sheet and then a post test for people who are asking for MABPC peer recovery specialist CEUs, an evaluation form for everybody, and then the final will be your certificate. And also I will send the PowerPoint separately too. So be on the lookout for some emails next week until you get your certificate. Thank you.
Thank you all. Take care of yourselves and thank you for the work that you do.
Thank you.
Thank you.
Thank you.